Epidemiology of acute kidney injury, critically treat children and young adults. Background: epidemiologic studies adults have shown that acute kidney injury is associated with increased mortality, prolonged mechanical ventilation, and prolonged length of stay in intensive care units. A single-center study involving adults revealed that mortality and morbidity were higher when both the plasma creatinine level and urine output were used to diagnose acute kidney injury than when either was used alone. A theme test. We conduct the assessment of worldwide acute kidney injury, renal angina, and epidemiology study to define the epidemiology of acute kidney injury and to characterize risk factors for acute kidney injury and associate with morbidity in a multinational cohort of critically ill children and young adults. We hypothesized that severe acute kidney injury was common and would increase the risk of death. Methods. This was a prospective observational study that recruited patients in 32 pediatric ICUs across Asia, Australia, Europe, and North America for 3 consecutive months in 2014. In brief, all patients between 3 months and 25 years of age with a predicted ICU stay at least 48 hours were eligible. Answers. The primary outcome was 28-day mortality. Secondary outcomes were length of stay in the ICU, receipt and duration of mechanical ventilation, receipt of extracorporeal membrane oxygenation, and receipt of renal replacement therapy. A total of 4,083 patients had no status with respect to both acute kidney injury and 38-day outcome. Among these patients, acute kidney injury developed in 1,261 patients, confidence interval, and severe acute kidney injury developed in 543 during the first 7 days after ICU admission. The maximum stage of acute kidney injury was stage 1 in 718 patients, stage 2 in 294 patients, and stage 3 in 249 patients. Statistical analysis. We performed sensitivity analysis to assess for difference in demographic and clinical characteristics, the rate of acute kidney injury, and secondary outcomes when data on the 28-day outcome were unavailable, and to assess for differences in 28-day mortality and secondary outcomes when data on the baseline plasma creatinine level were unavailable. Discussion. This large prospective multinational study of the epidemiology of acute kidney injury in children and young adults in ICUs showed that acute kidney injury occurred in 1/4 of patients during the first 7 days after ICU admission. Severe acute kidney injury conferred an incremental risk of death by day 28 and was associated with increased use of renal replacement therapy and mechanical ventilation and longer stays in the ICU.